Mr. Chairman, I hope we're still friends. And the comments that have been made by my colleagues about Medicaid, I welcome. We can stop talking about it if we all have an agreement that what's in the Republican-approved budget in terms of the number is not going to happen the way it's described in that. So I think apologies are not the right word for my friend, Mr. Wahlberg. I think there's a recognition that the end product hopefully will be what we can all agree on, much like the starting product was from the Senate and through the budget process until a certain point where we're reaching consensus. Ms. Lilly, I am a survivor of stage 4 chronic lymphocytic leukemia. I like to tell my friends that I was perfectly healthy until I became a member of Congress when I was diagnosed with stage 4 cancer. And then after that, because of my decreased immune system, just running on the mall, I took a freak fall 5 years ago at the beginning of COVID, was rushed to George Washington, and my doctors there told my kids when they flew out from California that I would die in the next 48 hours. So I have some expertise, not because I chose to, but because I'm a survivor of the American healthcare system. And we do agree that the United States we pay the most of any developed country for our healthcare, a fifth of the economy, looking at people who help pay for that and from a business perspective. Clearly this is broken, and we have the worst outcomes of any developed country. I mean, that's a simple statement. If I ran a restaurant, I was losing money, and I kept borrowing money to prop it up, I wouldn't be in business very long. And also, if I said I was going to cut my prices by 25%, I was also going to cut a third of my kitchen staff, I don't think people would believe me. So, Ms. Lilly, denials first, then I want to talk about the cuts at NIH and ACA. I've got an example that's not an anomaly where a gentleman, and again, as a consumer, I could not have done this without help. As you have said, Mr. Strauss, and having been a small business member, and I was a member of NFIB back when I was a Republican many years ago. I can barely remember sometimes. So trying to negotiate that, so there's denials, and as you alluded to, there's the denials before the denials, just trying to negotiate the system, which isn't just conspiracies or incompetence. I had a friend who used to say, I used to believe in conspiracies until I discovered incompetence. In this instance, I think it was a combination of both that you alluded to. But in the case of denials, one case that stands out to me is a gentleman named Tracy Pike from Illinois, father of 3, he had stomach cancer, stage 4. He had been all kinds of cases of precedents in let's see, Blue Shield of Illinois and Blue Cross of approving the operation. And then when he was getting ready to go, they denied the approval. He died because he was denied. Is that an anomaly, or is that what we're seeing more and more?
Unfortunately, it is not. I think it's something that we're seeing more and more as the cost of healthcare is increasing. And I'll add that, I think we testified before the ERISA Advisory Committee on this exact issue around denials recently, and that's part of my written testimony, so I'd refer everyone to that. But I will say, I think we don't know how many denials occur in employer-sponsored insurance. We don't have a lot of information, and that transparency is kind of the first step in that direction. The Office of Inspector General has looked at denials in both Medicaid managed care and in Medicare Advantage, where they are incredibly high. Folks don't know they can appeal denials. I mean, I think that the lack of consumer knowledge is also an incredibly important piece of this. Kaiser Family Foundation, KFF, does sponsor a regular survey of health consumers, and more than 50% of people had no idea they could appeal a denial.
I want to ask you about the cuts to NIH and ACA. As a survivor of leukemia, I wouldn't be here if it wasn't for investments over the last 70 years in research in the Department of Defense, first off, and at NIH and ACA. What is going to happen? Chronic CLL is the most common leukemia, affects everyone. Doctor told me if I was diagnosed with this 15 years ago, I'd be dead. Now I have a normal life expectancy times hundreds of thousands of Americans. What will these cuts that the administration's just done to the department and NIH, how will that affect life expectancy?
Half of cancer treatments in use today were developed by the NCI, the National Institute of Cancer. We need that research to advance the ball, to make sure that we have new treatments. And with cuts to that, we don't know. America has led in biomedical research for decades and decades. And that's why, sir, you're still alive with us today. And I don't know what will happen. We are monitoring this very carefully and very concerned.
The pill I have in my pocket that I'll take at 3 in the afternoon was paid for American taxpayers. It's now covered by Johnson & Johnson. They charge $500 a pill in this country. In Australia, it was 37, in the EU, it was 90. When the Biden administration, with us in leadership, negotiated those prices, it's now $90. So free market's great, but there's got to be some parameters to the free market. We live in a mixed market. Thank you, Mr. Chairman. I yield back.
The gentleman yields, and now I will recognize our former chairman and current chairman of the Rules Committee, Ms. Fox, for her questions.
Thank you, Mr. Chairman. Ms. Strauss, we often